Hi everyone, my name is Michael Flores. I'm at Physical Therapy Connections, and I'm just here to ask you guys just one simple thing. If you can give us a little feedback on what you'd actually like to see us make videos on. I'm here to do specifically a focus on the shoulder. So if you're having shoulder issues, I'd like to hear things about like um, what's making your shoulder hurt. Is there a certain thing at work? Is there a certain thing at home that makes it hurt? Or maybe you know already what the problem is. Maybe you know you have arthritis, or maybe it's a rotator cuff issue, or impingement, or bursitis, or any of those other fancy words. If you know you have a diagnosis, you can always let me know. And the reason I'm doing this is I want to get a little more specific on ways of helping you. So to make videos that are really specific to your individual needs. I could give you tips and tricks all day long for helping your shoulder to feel better, and you can try any and all of them. Some might work, some might not. But if I knew more specifically what I need to gear some of these videos and exercise treatments for, that'll help me to help you get yourselves better. Um, I'm hosting a workshop this June, so we're only doing these once a year now. I am just one specific shoulder workshop. We also have some different workshops throughout the year, things that are focused on headaches or knee issues, sports injuries, low back pain. Just keep your eyes out open for those as well. But I'm doing one specifically in June for shoulder problems. So give me all your feedback. Let us know on Facebook. Give us a like on different ways that we can help you, different situations that are hurting you. In the meantime, I want to show you one little trick today. Like I said, I can show you tips and tricks all day long, but here's one little trick that you can do to help make your shoulder feel better if you have an instability issue. So instability, that's it's more just, I would say, let's say if you had a rotator cuff injury, your rotator cuff muscle is not doing its job at 100%, so it doesn't necessarily have the full amount of stability. Meaning that if this is your ball and socket joint of your shoulder, the whole purpose of that rotator cuff is to draw this part of the ball into the socket. Yeah, your shoulder does all these different movements as well, and that's the rotator cuff does help out with those too, but its main job is to suck that ball right into the socket, make sure it's snug, nice and tight. So the way that we can do this is to load up all of our nerve receptors. They're called proprioceptors, and that's just a fancy name for building up your coordination and your strength and stability. So here's the trick. Find a wall, and make sure this feels okay when you're doing it too. I don't want you to do it if it hurts. But yeah, find a nice sturdy wall or a door that you can lean up against and keep your shoulders, I would say, less than shoulder height or at shoulder height. And all we're going to do what's called the corkscrew. So if you want to look at this elbow here, it starts off a little bit out to the side, but I'm going to screw it down into the floor. So that's the corkscrew part. That's building up some of that stability in the shoulder. And the proprioceptor part, those nerve receptors where we're making them fire more, that happens because we're putting weight through our arm. Our shoulder nerve receptors are sensing this stimulation. They're sensing a different sort of weight going through it, and that's where the stability comes in, the coordination part. So elbow goes out, and I'm going to go straight to down. The downwards part, that's the most important part. So I only show people to flare their elbows out just to notice the full range of motion, but I actually want you to get the elbow to point downwards, and that's where the corkscrew comes into play. So after you've corkscrewed both arms, you're locked and loaded, all we're going to do is add a little bit of movement side to side, a little bit of movement up and down, like you're sticking your butt out and your butt in. And then the last one, we're going to turn just a little bit to the right and just a little bit to the left. And again, make sure all these feel good. If any of it hurts, you can always modify it or give us a call. But yeah, definitely try some of these exercises out. See if they work for you. But again, the whole point of this video was to ask you guys if there's anything specifically that you would like us to make videos on for your shoulder to help get it feeling better. Again, my name is Michael Flores here at Physical Therapy Connections. Make sure to give us a like button, and I hope to read all your comments. Thank you.